Many of the patients at Peel Health Campus are over 65, so caring for people with cognitive impairment is integral for our service. The care we provide for patients living with dementia at Peel Health Campus is evolving as we learn more about the disease. What I think we do really well is we seek feedback, we listen to our patients and families because they're at the centre of our care.
SAFE is an adaptation of a program called Safe Wards. Safe Wards was introduced in the UK. We walk them through simulation where they can see what a patient with dementia may go through. We do certain little simulation games in our SAFE training in terms of if you've got a visual impairment, if you've got certain problems associated with dementia in terms of speech or language and what that's like to actually live in a world of a dementia patient. Early assessment of older patients who may have a cognitive impairment is essential, which is why we screen on admission. What we do when the patient is admitted and we realise that the patient has got a cognitive impairment, we find out from the carers is what do they like to do. So it's a really basic who am I. One of the biggest things that we did was signage. It's also very difficult for people with dementia to actually read signs as well. So we looked at the colour coding. One of the last colours the ageing eye sees is yellow. So what we did was we looked at signs for toilets and showers and bathrooms in a yellow background with blue writing.
So Jim Duckerman, his main complaint was around the fact that there were communication issues from the ward with him and also issues around the fact that the ward wasn't managing patients with cognitive impairment correctly.
Sue Birtwistle met with them first and spoke to Jim and his daughter and learned about what had happened and how we could have done better and how we could meet that need.
What they'd done is they were so interested in improving dementia care in the hospital environment, they'd gone away and done some research and they came back to present that. So I was invited to listen to that, and then after that we arranged to have a full day session and just map out a patient journey and find out from a dementia family's point of view how they found it, what the gaps in the service were, and basically just to see what we could learn from the experience.
Yeah, they took our complaint seriously, and so we sat down with Sue and we put out a great big spreadsheet and we went through the whole story from the time Pat came into ED until the time she passed away. And we went through every problem. From then on, the management went through them all, things started to develop, and I know there's been a lot of changes that we presented have already been implemented.
Well, the action plan looked at education. Education was a big thing that we needed to improve. So we got Carers WA to come in and do some education with our ED staff, our reception staff. The geriatrician did an education session with GPs to say, ring me, I'll give advice, you can start medication before they actually come to see me. So let's see if that makes improvements to patients' memory. And then the last thing we looked at was the environment. You know, the patient's in for a while, it's white walls, it's not inviting, so it was looking at what we could do to make it more stimulating.
So today we continue to work with Jim Duckerman. He sits on our community board of advice. He's been heavily involved in a lot of the work that we want to do around improvements. It's very powerful when you have somebody who's put a complaint in to talk to you about their experience. And he will talk to the staff here, let them know how he felt and what it meant to him, so that they truly understand and get that perspective.
It wasn't to berate the hospital, it was to get the story across, because we didn't want to see it happen to anybody else. I really couldn't be proud of the staff and the management of the hospital here. Yeah, they're doing a fine job.